as cases begin to stabilize here in Ontario, the province has laid out its plan to resume elective surgeries. Those surgeries were put on hold almost 8 weeks ago as hospitals made room for COVID-19 patients. But even as provincial officials have released their framework, there is no clear timeline yet, and it's still maybe weeks before the surgeries will resume.
To someone waiting for a surgery, nothing is more important. This has weighed heavily on all of us. And I want, more than anything, to get these surgeries and procedures back on track as soon as possible. I know the delays have led to anxiety and stress, but I hope today can help ease some concerns.
In order to resume scheduled surgeries, hospitals must meet two key requirements. They must reserve at least 15% of their acute care capacity for COVID-19 patients, and they must have a 30-day supply of personal protective equipment on hand. We did ask Ministry of Health officials how many hospitals are currently meeting those requirements. They don't have a number yet. The province has also laid out vague criteria for which cases should be prioritized. A report released last week estimated 35 people may have died because their cardiac surgeries weren't performed during the pandemic. And we've heard the Minister of Health say several times how heartbreaking it has been to delay cardiac and cancer procedures. But in their framework, there is no specific guideline to prioritize those surgeries, and hospitals must make those decisions themselves.
If people have been in need, if their circumstances and personal health was such that it was a life-threatening situation, I'm thinking particularly of cardiac or cancer surgery, it would have been done. It would have been done. There have been surgeries that have been ongoing at our hospitals.
Before any hospital can even begin to consider resuming surgeries, they must conduct weekly feasibility assessments that have to be signed off by both the hospital and regional health officials. So there is quite a bit of red tape to get through.
We know that we need to ramp them up. We know that there is a big backlog, and we want people to be able to get these surgeries. I know it's very, very anxiety provoking for people. If they have cancer and they're waiting to have this surgery, we want to be able to step it up as soon as we can.
But ministry officials estimate more than 50,000 procedures have been delayed during this pandemic, and it will take several weeks or even months to clear the backlog.
And just to compare, BC health officials have also released their framework to resume elective surgeries. They say it could take up to 2 years to catch up on all of the procedures and surgeries that have been missed over this time. They say it took just weeks to undo the gains they had made in regards to wait lists over the last 3 years.